You know, Ted Kennedy had said that this was the great issue of his life. This is the great issue of my life. This is really the issue that more than any others has brought me to the Congress, and that is health care. The dream of having affordable, quality health care available to all Americans. And the time is now. Agree with this particular solution, we know that the healthcare system is broken. Let me just give a few numbers to you. 1 out of every 3 people in America was uninsured for part of the last 2 years. And estimates are that, given the current recession, over 50 million children, women and men, are uninsured. More than half of all adults, 52%, went without something having to do with their health last year because they couldn't afford it. Didn't get a checkup, didn't get a procedure, didn't get a prescription filled. 62% of personal bankruptcies have medical costs as the key factor, and 78% of those people involved were insured when they became sick or injured. 14,000 people each and every day are losing their health coverage. That's nearly 10 people a minute. 22,000 people a year die because they are uninsured. That's 60 people every day. In Illinois, health insurance premiums have risen 89% since 2000. The number of uninsured is projected to increase from 47 to about 50 million to over 61 million people by 2020 if we don't do anything. This year, over 7 million seniors and people with disabilities will fall into what we call the donut hole. People on Medicare know what I'm talking about. That's for their prescription drugs, and have to pay 100% of the next $3,400 in their drug costs before they get help. Now, I understand that you don't want Congress to pass a bill that doesn't fix your problems, but I want you to just imagine for a minute what it will mean if all of us can work together to get it done. Imagine an America where if you get sick, you only have to worry about getting better, not about worrying how to pay your medical bills. Health insurance, you will never be denied because of a kid's Imagine knowing that if you have a child with a disability, or you have a disability, that doesn't mean that your premiums are going to go through the roof. Imagine if you lose your job, or have to change jobs, or want to change jobs, that you don't have to lose your insurance or change your doctor. Imagine knowing that you can get screened for cancer, not just that you don't have to pay cost sharing, but that if heaven forbid they find something, you can't be dropped from coverage. And imagine that pre-existing condition exclusions all become a relic of the past, not a barrier. So all of those things no longer have to be a dream for the United States of America. They can be a reality. And we're going back to Washington next week. The House has the job of pulling together the 3 bills that passed out of different committees, including mine, the Energy and Commerce Committee. The Senate will be working on its versions in its 2 committees, and we'll all come together, and I believe by the end of 2009, we will have affordable quality health care for all.